For women with metastatic triple-negative breast cancer, I think it is really essential to understand the PD-L1 status of that patient's tumor. In IMpassion130, testing for PD-L1 could have been performed on either the primary tumor or a metastatic focus. Remembering this was a first-line metastatic trial, even when the primary was tested, often the time between treatment and that tissue collection was only about 60 days. So these tumor specimens were largely representing untreated breast cancer. The primary tumor appeared to have a greater likelihood of testing PD-L1 positive, so that is something to keep in mind as you're considering which tissue to send for PD-L1 testing. I'll remind you the assay used in IMpassion130 was the Ventana SP142 assay, and the definition of PD-L1 positivity was 1% or greater staining in the immune cells. There was some nice subsequent reports on biomarker analysis after the initial presentation of these data, and it is really important to recognize that in the PD-L1 negative patients, there was no advantage to the addition of atezolizumab to nab-paclitaxel. And in all the different exploratory biomarkers examined, PD-L1 positivity by SP142 was the predictive biomarker of importance. There have been several other PD-L1 assays available used in other solid tumors, and these include the DACO antibody 22C3 and also the other Ventana antibody SP263. There was a wonderful presentation at ESMO this past year by Dr. Hope Rugo and colleagues exploring in a sort of post hoc analysis the performance of these other PD-L1 assays in the tumor specimens from IMpassion130. And I think the conclusion there is that these other PD-L1 assays were able to detect or find more patients classified as PD-L1 positive. For example, in the subset, there were about 600 patients that had tumor samples available for additional PD-L1 testing. And if you recall, the SP142 antibody was positive in about 41% of the IMpassion130 population. The antibody 22C3 classified almost 80% of tumors as PD-L1 positive. And the SP263 antibody classified about 75% of tumors PD-L1 positive. The real question is whether that positive result is predictive of benefit to atezolizumab. And unfortunately, there was poor suboptimal concordance between those other assays and SP142. Whereas all tumors that tested SP142 were likely also to be found as SP263 positive or 22C3 positive, positivity by those other assays in the absence of SP142 positivity did not seem to predict benefit to atezolizumab. So in short, SP142 PD-L1 positivity is the predictive biomarker for benefit from atezolizumab in addition to nab-paclitaxel. There has been work looking at other biomarkers beyond PD-L1 status to help predict benefit from checkpoint inhibitors such as atezolizumab. And in some of the exploratory analyses related to IMpassion130, there have been analyses for BRCA status, PD-L1 by other assays beyond SP142, and even an analysis of stromal TILs. We do know that stromal TILs are prognostic in triple-negative breast cancer, and that patients who have a high proportion of stromal TILs tend to do better, and that also applies to doing well with the use of a checkpoint inhibitor.